Hello, my name is Kevin Myles, and I'm the president of the Kansas State Conference of the NAACP, and I'm also the president of the Wichita branch of the NAACP. I wanted to take a moment and speak to you today, just very briefly, about the Kansas State Healthcare Freedom Amendment. The Kansas State Healthcare Freedom Amendment. And this is a proposed amendment to our state constitution, proposed last week in our legislature by Senators Mary Pilcher Cook, Representative Brenda Landwehr, and Representative Peggy Mast. What the Kansas Healthcare Freedom Amendment would do, in essence, is it would block the implementation of federal healthcare reform legislation here in the state of Kansas. Now, the very reason that I'm giving this talk, the reason that I'm filming this video is because in the ensuing week after it was introduced, as we went out and started to make our opinions known and to speak to reporters and whoever would listen about what we believe are the intended outcomes from this piece of legislation, I've seen a series of interviews with Senator Mary Pilcher Cook, wherein she stated that the intent is not to opt out of federal health care reform, and also that it is not an attempt to block the implementation of federal health care reform, but this is merely an act to protect the sovereignty and the freedom of Kansans. Well, I have a problem with that, and the reason I have a problem with that is statements like that are disingenuous at best. At best. And rather than take my word for it, let me give you some information so that you can look this up on your own. If you want to research the bill, it is Senate Concurrent Resolution 1626. Senate Concurrent Resolution 1626. You can look that up on the Kansas Legislature website. And that website is kslegislature.org. And if you just go to that website and look up Senate Concurrent Resolution 1626, you can see it for yourself, because what it would do is it would add a section 16 to our state constitution. And in section 16 of our state constitution, it would deem it to be unconstitutional for any bill, policy, or law to directly or indirectly compel any individual, company, employer, or business to purchase health care or to take part in any health care system or program. Now that is deceptively simple language. It is designed to mask the intent and the proposed outcomes. Let me tell you what those outcomes will be in layman's terms. When you look at the legislation making its way through the House and the Senate, both pieces of legislation in both houses of Congress, both of which include some form of a mandate. If you want to provide health care for people who don't have it, if you want to provide health insurance for people who have pre-existing conditions, you have to first expand the pool. If we're going to cover everybody, then we all have to share the risk. This is why that mandate appears in both versions of the bill. The version that passed the House and the version that passed the Senate included some version of the same mandate. Now, what the proposed Kansas Healthcare Freedom Amendment does is it prohibits, constitutionally, it prohibits the very mechanism that would provide the funding that would allow us to provide coverage for people with pre-existing conditions and to provide coverage for people who don't currently have coverage. That is shameful. And what is really shameful about it is that Senator Pilcher Cook and Representatives Landwehr and Representatives Mast, they know this. They know exactly what this bill would do, but they're counting on the fact that you don't. So they put it out and use flowery, patriotic language like freedom and sovereignty, hoping that no one ever digs into the details of the bill, because if you go into the details of the bill, there are only two possible funding mechanisms that would allow us to cover everybody with a health care reform plan. First off, you have to get everybody into the pool so that we can all share the risk. Or if you don't put everybody into the pool, the only other mechanism that we can go to is to cover the expense of healthcare reform through taxation. And they know that that would never fly. So if taxation is a non-starter, then using some form of a mandate is the only mechanism that we have at our disposal. And by making that constitutionally impossible, what they are doing is blocking healthcare reform here in the state of Kansas. Now, the reason why it's critical that we stand up and say something about this, there are 300,000 Kansans, 300,000 people right now here in the state of Kansas without health insurance who would instantly, under the bills being proposed in the House or the Senate, they would instantly be eligible for some form of quality and affordable health care. 300,000 people. There are 65,000 businesses, small businesses here in the state of Kansas that would be eligible for some form of tax credit that would allow them to provide coverage for their employees. And again, that is a possibility under the bills being proposed by the House or the Senate. There are 44,000 seniors here in the state of Kansas who would be able to close the loopholes in Medicare Part D under the bills being proposed in the House or the Senate. And there are 4,100 Kansan families who declare bankruptcy every year as a result of medical debt. So if we could, through embracing the idea of healthcare reform, if we could save 4,100 Kansan families a year from going into bankruptcy, if we could save 44,000 seniors and help 44,000 Kansan seniors close the loopholes in Medicare Part D, if we could provide tax credits for 65,000 Kansan small businesses so that those small businesses could provide coverage for their employees, and we could reach out and cover 300,000 Kansans who don't currently have health insurance, why wouldn't we do that? Why wouldn't we do that? But to hold up that process through bills and onerous pieces of legislation like this designed to provide some short-term political benefit at the expense of these people who need help the most is just wrong, and it's shameful. So what we are asking everyone to do is make sure that you take the time to educate yourself on this issue. To pass a constitutional amendment here in the state of Kansas, it has to pass by 2/3 of the legislature, and if it successfully passes 2/3 of the legislature, then it has to go to a public referendum, and that's where we can draw the line on this. But in order to get there, we need everybody to download a copy of this bill, study it, read it, and educate yourself, and then spread the word. We need everybody on board, informed and engaged. So go to kslegislature.org and look up Senate Concurrent Resolution 1626. Read the bill, study it, get educated, get on the phone, and make sure that you tell somebody. And then once you've done that, we need everybody to get on that phone and call your senator and your representatives here in the state of Kansas and let them know that we want to see health care reform here in the state of Kansas, and we are not fans of this type of political gamesmanship. We want and we expect that our legislators will be about the business of providing the best possible outcome for the people who they represent, and that means that they need to be on board with the idea of health care reform. No more gimmicks, no more tricks, no more flowery language about freedom and sovereignty and protecting things that aren't even being threatened. We want them on board with this effort, and if they cannot get on board with this effort, then we need to get organized and send them back to their day jobs. But in the meantime, if you can just get online, go to kslegislature.org, take a look at Senate Concurrent Resolution 1626, get informed, and let's get engaged. And once this hits the stage of a public referendum, should it go that far, then we'll all get to work. Thank you very much for listening.